director of the Black Health Care Commission for the state of Tennessee. And of course, Dr. Joyce, before we had our first commercial break, we were talking about some of the disparities between African Americans and other members of the population in the areas of health and et cetera. Let's allow you to expand upon those areas and to talk about the layout of some of these organizations and some of the efforts that you're making.
Basically, we work through other organizations, other health organizations that are already in place. We like to disseminate information to individuals on different health issues and topics. All they have to do is contact our office, and we in turn get the information out to them. We do exhibits across the state of Tennessee. We try to get the word out about the work of the Black Health Care Commission.
And in these exhibits, and I think you mentioned that you work through various health organizations, which is to say that the the American Cancer Society is already an established organization, and instead of trying to work around that organization, you simply appropriate for your organization that particular organization and then use the African American aspect of what you do. Is that what you're saying?
Yes. As a matter of fact, the Cervical and Cancer Coalition are working with our coalition members across the state and doing a cancer screening. Those are the kind of things we like to do. We like to work with organizations already in place doing the work. We provide them a group of people who are willing to work with them and to get the word out into the community.
And so you, the Tennessee Health Care Commission has a staff of individuals that that you can assign. Is that what you're saying?
Yes, as a matter of fact, but they're not staff, they are volunteers. These are persons with full-time jobs. They volunteer their time and effort to help us get the word out across the state.
You know, one of the problems I think we've had in terms of dealing with this kind of effort is the fact that folks seldom are willing to volunteer. What have you found in terms of the people that are working with you?
The volunteer work is overwhelming. They know the need is there in the community. They're willing to assist, and it's been real good.
And so you don't have any real questions or any real problems if you go into a community and you're looking for assistance and aid and whatnot to have folks to come out and volunteer. Is that what you're saying?
Right now, we've had a good turnout. Of course, we can always use more help, and there's always a lot of work out there to do, but so far we've had good results.
You know, I think quite recently, and let's be more specific in terms of one of the diseases I think that all of us are familiar with, and one that we've dealt with quite a bit on this show, and that is this question of AIDS. What is the effort that the Tennessee Black Health Care Commission is making in that particular area of health?
Well, it is very prevalent, even here in Tennessee. There are efforts through Nashville Cares and other organizations like that. We did have a workshop last year that dealt specifically with AIDS. We brought it next. Well, as a matter of fact, the individual who was the speaker is she herself was infected. She talked with the group. She let everybody know about they need to look at preventive measures. And then once one has the disease, there are steps that needs to be taken. So just a discussion and dissemination of information is what we've done on that.
And you think that you've been quite successful in reaching a number of people dealing with this issue?
Yes, we have been, but still not quite enough. We need to do even more.
Okay, so you're doing quite a bit dealing with the areas of prevention and dissemination of information, but you still don't believe that you've done as much as you possibly can do?
There's much more to do.
Very good. Now, you also mentioned, I think, the fact that along with these summits, that you have special kinds of committees that are organized in various jurisdictions and whatnot. Now, the Tennessee Health Care Commission covers the entire state of Tennessee. How is that broken down? How is that organized?
The coalition broken down, we have one in the Memphis area, one in rural West Tennessee, one here in Nashville, Chattanooga, Knoxville, and even the upper East Tennessee area.
Well, now, how does the issues that one would deal with in East Tennessee compare with the issues that might be dealt with in Middle Tennessee, West Tennessee, and et cetera? Are there any problems, or are there any differences or whatnot?
Well, basically, the issues are basically the same. They have to be dealt with and worked through the community differently. Like in Upper East Tennessee, there are fewer minorities in that area. There are fewer organizations to even work through. Whereas in Memphis and maybe Nashville, there are a lot of organizations already out there doing health issue concern work, and we sort of work through them. Now, rural West Tennessee, they too are a little different, but one area across the state, and that was access to doctors in the rural areas. That's one concern that runs.
That's consistent in Memphis or Knoxville or wherever. And now this is a question of access to doctors. Now, explain that. What
well,
are we saying?
Basically, I was talking about the rural areas where elderly is having to travel long distances just to see the doctor, and then they have to wait a long time to see the doctor. And that sometimes discourages individuals from going to the doctors. And I think that was a concern that the rural West Tennessee area had expressed.
And but you found consistently throughout the jurisdictions, out the north, out the middle, west, and the east jurisdiction, that there are some severe health questions that will impact both African Americans and other parts of the population, minorities and other parts of the population, but they will have a special impact upon African Americans, and thereby that's the justification for the establishment of such a commission.
And also the health disparities.
The health
the disparities in the
between
the health statuses
of the various groups across the. Now, how is that done? How is this disparity recognized, and how do you study this?
Well, the disparity studies, we've gotten them from the Center of Disease Control, and also Meharry has done several of them. And even the Office of Minority Health through the Department of Health have given us information on this. And
so you've got all the statistical information that you need to demonstrate that African Americans, for example, make up 17% of the cases of diabetes in the state of Tennessee, but make up 17% of the population, but perhaps 50% of the cases of diabetes in the state of Tennessee, and that this great disparity. And I say that primarily because we've also had many individuals to talk about the various disparities between cancer, AIDS, diabetes, and et cetera, which is to say that it's pretty consistent, and I guess in a real sense, that's what justifies what you're doing here. That is, a special commission has been appointed. And we're going to take this commercial break, and we'll be back with our audience following.